Hello people, in this video let us look at this case study. Okay, ready? An elderly male presented with a history of deep jaundice and severe itching. History itself they have given off he has jaundice. Okay, he was clinically diagnosed to have carcinoma of the head of the pancreas. So this pancreas head, right, that has a carcinoma. He has deep jaundice. Interpretation of the liver function test: serum bilirubin is more, conjugated direct bilirubin also more. AST is fine, ALT looks fine. I think these two look fine to me because I remember 5 to 40 is normal. So these two look fine. Alkaline phosphatase 1800 looks extremely high. What do you think? Don't you think that this is extremely high? Give me a different color, please. This one looks a little high. Serum alkaline phosphatase. What do you think is the normal value of serum alkaline phosphatase? So the alkaline phosphatase, where is it? Here. Alkaline phosphatase normal for male, adult male is 25 to 120. So obviously it is very, very high in this. It should be 25 to 120. So obviously this is extremely high, guys. So this is high. Great. This is more. This is more. These are fine. These are looking fine. Okay, volume, color is looking more dark yellow. Bile salts, it should not be there, so they are more. Bile pigments are more. Then scroll down. Urobilinogen is absent. Actually, urobilinogen, it can be present as a normal constituent. Okay. Now, what is the diagnosis? Write 2 points in favor of your diagnosis. Okay. So let us look at what is your diagnosis, guys? So it's some kind of a jaundice, which is obstructive jaundice. The liver is fine because ALT and AST are fine. What else you feel now? Mention other two causes of this condition. Other two causes. What are the causes? First of all, that only we don't know. Then they name the types of jaundice. What are the types of jaundice? Okay, so all the answers have been found. Look at this. What is the diagnosis? Obstructive jaundice or post-hepatic jaundice. Why do you say this? Why do you say this? That's what they're asking here. Why are you saying that? It is proof 2 points in your favor. They are saying because here the serum alkaline phosphatase is more, right? Serum alkaline phosphatase is more. Normal should be some, what did you say normal is? That's the normal level. Normal level in adult male is not 25 to 120. It should be. Please write it here only. Otherwise, every time we can't come and search here. Normal is 25 to 150. What is it? 25 to 120 units per liter. Here, how much is it? 1800 international units per liter. So it is much 3 times more than normal. So that is why we are saying it is obstructive jaundice, and conjugated bilirubin should be greater than 50% of the total. Okay, conjugated bilirubin should be greater than 50%. So here you can see here the conjugated bilirubin or the direct serum bilirubin is 6.1. It is more than 50% of the total. Urobilinogen will be less. Urobilinogen is absent. Okay, so that is why you're saying all that. Then coming to what are the causes? Causes will be gallstones, right? Gallbladder stones. What do you call this? Cholithiasis. Then they will ask you types of gallstones, everything you'll have to explain. Then cancer can be there of the biliary system, or pancreas also can cause this issue. Okay. What are the types of jaundice? Types of jaundice are pre-hepatic, that will be hemolytic, or hepatic, or post-hepatic. In this case, this is only post-hepatic or obstructive. Okay. Now here exactly what happens. The extrahepatic biliary tract obstruction prevents the flow of bile into the duodenum. So the bile cannot flow into the duodenum. So regurgitation of this bile will happen into the circulation. So that's why you're seeing all this jaundice. Bilirubin is more in the blood. Just pay some attention here to this types of jaundice, pre-hepatic, hepatic and post-hepatic. See, some differences they ask you between these also you should be able to tell. Now in pre-hepatic jaundice, basically it is hemolytic, right? Here there is mainly what will be there? Unconjugated will be there. Right, here mainly unconjugated bilirubin will be there because there is so much of hemolysis that whatever is possible the liver will conjugate, but otherwise it will be unconjugated. Mainly unconjugated bilirubin will be there. Here what will happen? The urobilinogen in the urine will be more. urobilinogen in the urine will be more, remember more, okay. Here clotting time, this prothrombin time and all is normal, okay. Here clotting and all, blood clotting is not affected, okay. That is what you have to remember. In hepatic what happens, and in post-hepatic also, there is abnormal blood clotting. Prothrombin time is abnormal in these two, okay. In hepatic what happens, the liver itself is affected. So it is, even if you give vitamin K, this abnormal prothrombin time cannot be corrected, because the clotting factors extra which the liver makes, they themselves are not proper, right? But in post-hepatic obstructive, it is abnormal prothrombin time, but you can correct it with vitamin K, because the liver is fine. That's what you have to focus here. Here the liver will be fine, okay. So that was about the differences between the jaundice. So this case study we have finished. This was about obstructive jaundice, okay. So we'll meet you in the next video. For now, that's all in this video, okay. Bye bye.